Hi there, it's Dr. Moyer. Welcome to Chapter 13. We're almost done this semester, and although I've enjoyed it a great deal, I am sure that I'm not the only one looking forward to a rest. Anyways, here is Chapter 13, where we're going to talk about human reproduction. Some of this is a little review from the anatomy and menstruation, stuff like that. The menstrual cycle and ovulation. So, as many of you may or may not know, pregnancy begins with the union of the ovum, which is the egg, and a sperm. Ovulation occurs about 14 days before a woman's next menstrual cycle, and the sperm must get to the ovum within a 24-hour period following its release from the ovary. Women that pay close attention to their body changes throughout the menstrual cycle are more successful at predicting ovulation. For example, at ovulation, cervical mucus is clear and thin like egg white, and women also experience changes in body temperature, just a few tenths of a degree, followed by an increase body temperature, and this remains elevated until the next cycle. And then sometimes a little bit of cramping can accompany ovulation. But drugstores make kits now, which is actually much easier than trying to follow the mucus and the cramps. Okay, so conception, the sperm, if it makes a successful journey to the fallopian tube, up to the vagina, the cervix, the uterus, and then to the tube where the ovum is located. A normal ejaculation contains about 250 to 500 million sperm, but only one is actually needed to penetrate the membrane of the egg. Interestingly enough, once the implantation takes effect, the fertilized egg begins rapid cell division. It travels down the fallopian tube to the uterus over the next 3 to 4 days and attaches itself to the uterine wall. That's called implantation. So once it's implanted, the fertilized egg is then referred to as an embryo. It's referred to as an embryo for 8 weeks, after which it is then referred to as a fetus. Okay, so during pregnancy, we refer to this as the gestation period, which is the time representing pregnancy and development of the fetus from conception to birth. Gestation averages about 40 weeks, starts with the first day of the woman's last menstrual cycle, which is why the doctor will ask, what was the first day of your last menstrual cycle? Normal birth takes place between the 38th and the 42nd week. You can see there's a lot of variation there. And although women tend to freak out and want the baby to be delivered exactly on the day that it was supposed to be or predicted to be, there is actually room for a lot of variation. Deliveries before the 38th week are considered premature. Deliveries after the 42nd week can threaten the health of the baby, and so what will happen is oftentimes labor is induced with chemicals or medications so that she can have the baby and prevent those health problems. Okay, so we'll go over the 3 trimesters and what kind of changes are happening. During the first trimester, which would be the first 3 months of pregnancy, all the structures and systems develop in their basic form. So at the end of the first trimester, the fetus will have arms, legs, feet, fingers, and the vital organs and body systems are functioning. The fetus weighs approximately 1 ounce after the first trimester and is approximately 4 inches in length. Still very tiny. During the second trimester, the fetal systems continue to grow and mature, but now the sex organs start developing and are apparent, as is body hair, including eyebrows and eyelashes. During the 5th month, fetal movement is usually active enough that the mother feels it. And at the end of the second trimester, the fetus is close to 12 inches long and weighs between 1 and 1.5 pounds. Nowadays we have the ultrasound that actually shows a 3D image, which is really crazy. If you've seen that before, you can actually see so much detail compared to the old days when all you could kind of see was some white. I don't know. It looked like white to me on a screen where then the doctor would circle where the head was, etc. Much better now. And then during the 3rd trimester, of course, the systems continue to grow and mature. The last system to develop is the respiratory system. At birth, most babies are approximately 20 inches in length and weigh between 6 and 9 pounds. So the respiratory system being the last to develop is often why, if there is a premature birth, that is one of the main concerns, is about the lungs and making sure the baby can breathe. And which is why babies will oftentimes, if they are premature and haven't fully developed the respiratory system, they will be put on a machine to help them breathe. Okay, lovemaking during pregnancy. So some of the issues around pregnancy do concern, is it okay to make love or to have intercourse? You can definitely continue throughout an entire pregnancy. There's not a cutoff time, according to doctors or biology. It's completely up to the couple. Oral sex can be continued, but air should not be blown into the vagina, as that can actually cause an air embolism, which is a blockage of a blood vessel by an air bubble, and that can be potentially fatal for mother and child. Pregnant women should not have sex with a partner whose sexual history is unknown. You don't want to expose the fetus to a sexually transmitted disease such as herpes, genital warts, chlamydia, or even HIV. If you become infected, the disease could be transmitted to the fetus with potentially dangerous consequences. So you want to avoid that. If there are particular risks or concerns, the doctor or a midwife will advise against intercourse. But most women who are having a normal pregnancy can continue to have intercourse right up until their water breaks or they go into labor. You can't hurt the baby by making love. The amniotic sac and the strong muscles of the uterus actually protect the baby, and the thick mucus plug, I know that sounds gross, but the thick mucus plug actually seals the cervix and helps to guard against infection, so it's there for protection. Okay, so childbirth process. There are actually 3 stages. The first stage, which consists of the contractions, it's marked by the dilation of the cervix to 10 centimeters or 4 inches. The end of the first stage is marked by very intense contractions, so they'll become much more painful. Some women experience chills, vomiting, and irritability. The second stage is referred to often as the crowning, but this is considered the pushing, the crowning, the delivery stage. This is the actual birth of the baby, and it is the shortest stage, probably thankfully, since that's when the contractions are most intense. And then the third stage is the delivery of the placenta. Or sometimes it's referred to as afterbirth, and this can take about 15 minutes. After childbirth, there can be some postpartum issues. Many of you have probably heard of postpartum depression. So some of the psychological issues are the bonding that occurs. The mother should try to bond with the infant, as should fathers or the partners that are helping to raise the child. About 10% of women experience postpartum depression, and that can be severe enough where they actually have to seek help from a professional and consider getting antidepressants or therapy or however else they can be helped. But it is very serious. It's not in the woman's mind. It is something that we have to look out for. As far as the physical effects of what's happening, the uterus shrinks back to its normal size after about 6 weeks. The vagina, although it was stretched, it shrinks back. It may seem soft and slack for a while, but it will bounce back. It's very elastic. Many women find that doing leg lifts and abdominal exercises helps to restore muscle tone. Breastfeeding actually can help women that are concerned with losing weight. So not only is it good for the baby, very beneficial for the baby, but it's also beneficial for the mother. Some of the advantages of breastfeeding include essential nutrients and disease-fighting antibodies that are delivered to the infant through the breast milk. It helps prevent infant diarrhea. It's always available. It's right there, and it's always the right temperature, unless it's being pumped and stored. As I mentioned, it helps women lose weight faster, and it actually increases the likelihood of the emotional closeness between mother and infant. However, some women report they have trouble with breastfeeding. They're just not able to get the baby to take to the breast. And that bonding that women then become concerned about can still be mimicked with bottle feeding as well. So some of the important things that occur during breastfeeding that researchers have noted is the mother stroking the baby's face while they're feeding, or the father. Father can do this as well and should, holding the baby, looking into their eyes while they're being fed. So not just, breastfeeding and looking away. Women are more likely to look at the baby while they're actually breastfeeding over bottle feeding. But if you make a conscious decision, you know that the bonding is important, you can do that as well. For infertility, about 20% of all infertility is actually caused by sexually transmitted infections, or STDs, they used to be called, particularly chlamydia and gonorrhea. Those are the most common ones that can cause infertility. And that's one of the reasons why, especially with chlamydia, which can show no symptoms at all, people need to be checked, both males and females. For males, common causes of infertility include low sperm production, low sperm motility, meaning how much movement, scar tissue from prior surgery, severe sexual dysfunction, even nutrition and health, or swollen veins in the scrotum. Females, some common causes, the failure to ovulate, either due to a hormonal imbalance or sometimes even vigorous exercise can cause that. Scar tissue from an STI or an IUD, which is an inner uterine device used as a form of birth control. Endometriosis can also cause infertility. Structural disorders of the uterus or cervix, and even extreme obesity. About 30 to 40% of women with endometriosis are infertile as a result of the condition, and 3 to 18% of women have the condition. It's actually hard to pinpoint exact numbers because a lot of women have endometriosis and don't know it until they have problems. As far as, who's more likely to be the cause of infertility, the issue actually is with the male 1/3 of the time, with the female 1/3 of the time. 15 to 20% of the time it's both. And then there's this 13 to 18% that's just unexplained. Doctors can't figure out, they rule everything out and they can't figure it out. But stress actually can contribute to becoming pregnant. So many times you've probably heard of the concept where a couple will adopt a baby and then the woman will become pregnant after that, often because that stress or that pressure has been relieved, and so they're able to conceive. Some psychological aspects of infertility, it can be a very serious issue, and people should be very careful about asking whether or not people plan on having children. I know that is sometimes the expected trajectory for couples, both heterosexual and same-sex. Typically we'll be asked, when are you going to have a baby? This is a very personal issue, and one I hope you guys take seriously after hearing this lecture. Wanting a baby but not being able to conceive can be a very desperate and painful experience, and should not be undermined or even joked about. There's a feeling of a loss of control, even a loss of hope. Women and men report feeling inadequate. The pressure, which is what I'm trying to teach you to avoid putting on other people, outside pressure from well-meaning friends and family can really exacerbate those feelings. Anxiety and depression can actually hinder the ability to conceive. So, while one woman may be struggling with infertility, you don't want anything to be exacerbating it because of the anxiety, the effect of anxiety and depression on fertility. So, although it's well-meaning, try to remember it's a personal choice, and unless a couple offers to discuss it themselves, probably you should just mind your own business and back off. Try to remember that if you are wanting to be a grandparent, a lot of that pressure comes from the parents of the couple. And I would just ask that you really think about how you would react if you were not able to conceive, because there is such a focus on raising children in this country and forming families. Okay, that is what I have for this chapter, and that concludes my little talk. Thank you.